Hello, this is Dr. Marty Klein, licensed marriage and family therapist in Palo Alto, California, the heart of Silicon Valley. Ozempic, Mounjaro, Wegovy. It seems that every day there's another podcast or article about these new drugs. For many, they are indeed wonder drugs, facilitating weight losses of 25, 45, 75 pounds or more, with few, if any, side effects. It's no wonder that 15 million Americans are taking these drugs right now. That's why the Zor Institute asked me to do my next webinar on this important psychodynamic, marital, and family issue. In one fast-paced hour, we'll start with some basic medical facts. Then we'll get into the interesting stuff. What happens when your patients take these drugs? How do their relationships change? Their self-image? What happens when buying clothes is no longer depressing, but exciting? We'll talk about the effects beyond weight loss. There's the changed relationship to food, the end of that constant low-grade internal noise about the next snack or meal. There's the miraculous experience of leaving over food that tastes really good, and the intriguing question of, if I feel down and I don't turn to food to medicate my feelings, what will I do? Typically, the mate, friends, or kids of these patients aren't on one of these drugs. So when loved ones don't share these amazing experiences where they lose interest in hearing about it again and again, do these patients feel alone? For adults who have spent their lives walking the painful tightrope between I want and I shouldn't, the most astonishing thing about these drugs is that they facilitate weight loss without deprivation, without the loss of enjoyment of favorite foods, from enchiladas to ice cream. These patients now eat moderately because they want to, not because they have to. Ironically, some of them feel ashamed that they accomplished their life's dream with so little suffering. And some observers look down on their wonderful triumph. You used a drug, so it wasn't difficult enough. In the next 3 years, the price of these drugs will drop dramatically. Then, even more of your patients will be taking them. Don't get left behind. Join me as we investigate this amazing modern phenomenon in my April 18th Zor Institute webinar. I'll see you there.